Hello everyone and welcome to The Prominent Ones, the show that brings us with the latest and the most elite personals, women if we can say, in Kuwait, to know more about their achievements as well as what do they do. And before we start our show for today, how about I greet my colleague Hiba. And hello Hiba.
Hello Amal, it's always a pleasure being here with you. Of course, I'm presenting to our guest our episode where we're going to know more about her guest, a woman that she made a very great imprint when it comes into her work achievement and of course reaching towards her goals and dreams. And with that, we're going to head to a break to know more about her guest, so stay tuned to this. And we are back, dear viewers, to welcome with us our guest, Dr. Tala Al-Dabbous. She's the CEO and Director of Clinical Service of Beit Abdullah Children's Hospital and also the lead clinical dietitian of intravenous nutrition and tube feeding at Al-Adan Hospital ICU. Really happy to have you here and welcome with us in The Prominent Ones.
Thank you. It's a pleasure and an honor to be here.
It is really a great honor to have one of the prominent ones with us, Dr. Tala Al-Dabbous. And first of all, we'd like to know more about your field.
Sure, yes, definitely. So I have two fields I work in that complement each other. My primary field is in clinical dietetics and my second field in palliative care. So I started off by studying pre-med and clinical dietetics for my undergraduate education. And then I continued on my palliative care journey. So when I started out initially, I was doing my residency at UCLA Children's Hospital in California, and I started out by studying solid tumors in children. And then when I was introduced to the palliative care team, it was something new for me. I never heard of palliative care. And palliative care, in essence, is about providing comfort and quality of life to children or adults alike struggling with life-threatening and life-limiting illnesses. So I started out by, before I came back to Kuwait, I started in my profession before I came back to Kuwait. And when I came back to Kuwait, I wasn't sure where I was going to work because to my knowledge, there was nothing about palliative care going on in Kuwait. Yes.
It's a very difficult, let's say, field that you actually chose, and something very, working as a doctor, especially in the medical field, needs a lot of care, especially when we're dealing with different kind of people, and of course when it comes into their cases. But when we're talking more about this specific field, it's very sensitive, very, let's say, responsible when it comes into dealing with all of different kind of, let's say, emotions that they go through. So having that said, I'm very sure it was challenging to choose such a field, but we want to know the story behind it. Like, was it a certain, let's say, knowledge that you actually got through where it made you more and encouraged you more to go through this specialization?
Definitely. So I chose to go into clinical dietetics when my brother was diagnosed with type 1 diabetes as a child. And when I saw how his clinical dietitian impacted his overall care, I felt that that was a very important field to enter. So that's how it started, and I finished my undergraduate education as a pre-med in clinical dietetics. Now, moving forward in my education, when I started my dietetic residency, I saw that most of medicine is focused on curative treatment. And that when you say medicine, people think cure. When you say medicine, people think cure. The two words are related. But medicine is not only about curing, it's also about improving quality of life. And someone doesn't have to be diagnosed with a life-threatening or life-limiting illness for them to have a better quality of life. A healthy individual can make some small adjustments to their daily life to have a better quality of life. As you can see with obesity. So if someone with obesity were to get on the health track, you know, and start taking care of themselves better and eat what they want to eat, but in moderation, started exercising, you will automatically notice that their breathing has improved, their posture has improved, everything starts to improve. So quality of life doesn't only impact palliative care patients. So when I was doing my residency, a very, I call them, you know, life-changing moments, a very big life-changing moment occurred. So I was looking after a 6-year-old boy with a brain tumor, and my mentor told me, you have to go talk to this mother and tell her that she can no longer feed her son because she's feeding him and he's choking. He can't swallow anymore. Yeah. So it's a big risk. And I said, definitely the risk of aspiration, which is also, you know, choking when something goes down the wrong tube into the trachea. And when I went to this mother, she wouldn't take no for an answer. And the way they do things there is they throw you in the deep end and see if you can sink or swim. So this mother wasn't taking no for an answer. So I left the room. I said, okay, what can I do to help this mother? So I went into the kitchen, although my field has very little to do with actual food and more to do with, yes. So what happened was I went to the kitchen. I knew that he loved strawberries because I would pass by the little cart on the road on the way to the hospital from my apartment building and pick up some strawberries for him on a daily basis. And I blended some strawberries up in a blender, put them in an ice cube tray. Literally, I had to wait for the ice cubes to freeze. I took the ice cube to the mother. I said, here, how about you put your finger on this and put it on his lips and the tip of his tongue? So he was semi-conscious. He wasn't unconscious, but he wasn't fully conscious. Okay. And when she did that, he opened his mouth. So she got a very big reaction where he wasn't reacting at all before that. So then the mother stopped force feeding him. Okay. So that's when I began to notice that it's not about volume. It's just about keeping that, I call it emotional pathway intact between mother and child, which develops right after birth, during pregnancy and right after birth. Yes, so I focused my research primarily on that throughout the rest of my career, on that pathway.
This is an amazing story, and it was really, we are all touched about that story because you have pinpoint the empathy of the mother towards her child. She wants to feed him because she doesn't want the connection to be cut. Exactly. And by that you just you caught that moment of okay, we can give you something, you can keep that connection by doing something very similar to what you're doing. And it's amazing, Dr. Tala. Thank you for sharing such a story with us. I want to know more about the speciality of intravenous and tube nutrition.
Yeah, sure. So clinical dietetics has expanded a lot over the past few years. Okay. And now you have, you know, so when a physician enters medical school, they take 1, maybe 2, depending on the school, classes on clinical dietetics. Okay. So it's very little. So the knowledge that they have, they usually rely on the clinical dietitian involved, because you have to study pre-med and enter the medical track to go into this field. So when I moved back to Kuwait, I noticed that physicians were making the decisions and clinical dietitians weren't as involved, and they would be afraid to speak their mind during rounds. And that's one of the first things I said, wait, stop, there's something wrong here, you know. We have to have more of an interdisciplinary approach. Okay. And when I say interdisciplinary, I mean not every speciality seeing the patient and making decisions on their own, but every speciality seeing the patient, child or adult. You know, I try to refrain from using the word patient because it dehumanizes our connection with them. So, decisions are essentially made together using an interdisciplinary approach. And when it comes to tube feeding, which is also referred to as enteral feeding, and parenteral nutrition, it used to be called total parenteral nutrition, but now it's called parenteral nutrition, which is IV feeding. Yes, it is a very delicate speciality, and it requires a wide range of expertise. And it requires a person to be very focused on everything that's going on a cellular level in the body. Because in essence, you are prescribing nutrients, macro and micronutrients. Yeah. So when we talk about macronutrients, we're talking about protein, carbohydrate, fat. When we're talking about micronutrients, we're talking about vitamins and minerals, you know. So they're prescribed to the gram per kilogram per person.
Okay.
So the old way of prescribing was, okay, we have a female that weighs 17 kilos, a child, 30% protein, 15% fat. It used to be done by percentages, which is the wrong way of doing things. Everything needs to be prescribed per gram per kilogram.
Okay. So instead of taking it as a percentage, you are taking the per gram, so you can have the enough nutrition for each person.
So you can make sure that they are meeting their needs,
and requirements.
their requirements at the gram and milligram level.
Okay.
So essentially why that's important is that everyone is different.
That's true.
And everyone's body makeup is different.
Right.
So, you know, the percentage of bone density to muscle mass to fat mass is different in each and every one of us.
Indeed.
Even if you took two people that looked exactly the same, and you scanned their body to check their muscle mass or fat mass, you would see that they're completely different.
True.
So essentially it's about meeting the person's need on a deeper level. Because once you prescribe grams per kilogram, say let's take protein for example, right? And it's an IV solution, yeah?
Yes.
So we know that the protein that we have here in Kuwait is 10% stock solution. We don't have higher percentages of protein.
Okay.
So if I'm prescribing protein and I'm prescribing everything and I don't know the volume, so not just the weight but the volume, how much ml is it going to give me?
Okay.
And then calculating the osmolarity, which means basically in essence we're calculating the strength of the concentration of the solution.
Yes.
So we know that not all veins can tolerate high
Density.
density,
Yes.
exactly. So that's why when I teach, you know, the future generation of clinical dietitians, I make sure to teach them not only to prescribe by gram per kilogram, but also to prescribe volume as well as osmolarity, because usually they leave it to the pharmacists, right?
Yes.
But we don't have parenteral nutrition pharmacists specifically here in Kuwait.
Right.
They're just pharmacists that are trained, and they're doing a good job, but they're trained to be specialized in this, not by education, but through training.
Yes, through the field itself, let's say. And
Yes, there's
everything that's
nothing wrong
happening.
with that, but that's how it's happening. So
Yes.
you have to teach the person prescribing to have that same kind of accountability, so we can make sure less errors happen down the line.
Yeah.
Yes.
This is really interesting, and it is
Indeed.
an important, let's say, field that should be really majored, and should the word be spread around. Dr. Tala, we have a lot to ask you, because it
Sure,
is
go
an
ahead.
interesting field. But let's how about we take a quick break, then continue
Sure,
with the
no
prominent.
problem.
A quick break, dear viewers, then continue with the prominent ones.
And we're back, dear viewers, to talk more with our guest, Dr. Tala Al-Dabbous. So, talking more about the field itself, I'm very sure people, especially now that they're hearing us, are starting to understand more when it comes into the field and when it comes into all of the precautions that it follows. So, talking about awareness and people understanding that, do you feel that we are reaching towards the point that people do understand these kind of concepts and these kind of concepts, especially when it comes into talking about dietitians, talking more about the clinical nutrition itself? Like, are we still in that kind of phase?
It's a tricky question because it depends where you are, and even within the same country, it depends where in the country you are.
Yes.
So in essence, people that have seen the impact of the speciality on the patients themselves are very aware and tend to always involve
Yes.
clinical dietitian. But when someone's been doing it themselves instead of relying on someone specialized in the field, they might not have that level of awareness. But we come from a curious community, curious in a good way.
Right.
So we always want to know what's going on, how does this work, and that's why you have a large percentage of the population that have either a high level of intellect or a high level of social skills, because our population is very curious. So I would say, due to that curiosity in terms of IV nutrition and tube feeding, yes, we are at that level of awareness as a country.
Okay.
Not all countries are, but as a country, yes. But in terms of palliative care, no, we are not at a level of awareness as to where we should aspire to be.
No, this is really interesting. So how can we make sure that we spread more awareness about the palliative care?
So as Beit Abdullah, we're working on a global campaign, which you should stay tuned for in 2025. And this plans for this global campaign are confidential at the time, but we have very big plans for it to take a global for it to have a global presence.
Okay.
So we have spoken to the people that we need to speak to get that global traction. And once I can share more information with you, I definitely will. And we keep on having booths in different malls, going on TV shows and talking about it, having awareness days, involving the media and press, because yes, we have a responsibility of being in the field of palliative care, of raising awareness, but there's also a social responsibility of the population itself to tune in to these programs, to learn about it. And it's also the responsibility of people who interview people, right? Yes. Like today, to ask the important questions. So we're getting there.
Yes, hopefully we do get there, and hopefully everyone who's watching us starting to understand more about the field itself and the demand that it actually requires. So when we're talking more about you as a female, and especially one of a kind, working in the palliative care itself and dealing with the field itself, I'm very sure it must be hectic, busy, and so on. So one of the things that we need to highlight is, do we need, or let's say, is the requirement for female demand in this let's say, specialty is actually required and wanted when it comes into that?
It's a very good question. So I'll start by answering the first part of your question. You said, as you are one of a kind. We're all one of a kind, right? And one of my favorite quotes by Rumi is that there are thousands of ways to lean down and kiss the ground, right? So everyone in their own job is as important as the other. So say, for example, we take a cleaner. So I'm sorry I'm focusing on this point, but it's very important to me. So say we take like a cleaner that's cleaning the streets as an example. And say there's a young boy who needs brain surgery, okay? Like the child I talked to you about earlier in the show. That child needs brain surgery, but say the cleaners haven't been cleaning the streets for 4 months. So if the neurosurgeon were to get into his car to drive to the hospital, which is not that far away from his house, would he be able to make it to the hospital if the cleaner didn't clean up the piling trash on the street? No. So then it's a philosophical question. Who is more important, the neurosurgeon or the cleaner?
Okay, yeah.
So everyone is one of a kind in their own essence, in their own way. Now I'll answer the second portion of your question. So the second portion of your question is, do you think, you know, there's a need to spread awareness for females joining this field? And the answer is, without a shadow of a doubt, yes. And the reason why is because it's been shown and demonstrated in studies that females have more cognitive empathy than males. And the field requires a lot of cognitive empathy. So cognitive empathy differs from empathy in the sense where it's about having the intellectual ability to feel and understand what someone else is feeling and understanding. Yes. Because palliative care is all about the art of communication. So how do you break bad news to a family member? How do you speak to them? What language do you use? Do you get at their level, physically, educationally, to be able to share that information, or you just do you just stand up and throw big words at them, right? So because at the University of Cambridge did the study, and I think they did it across multiple countries. I think it was at least 50 countries, and out of those countries, 36 countries showed a statistical significance in women having the ability to have cognitive empathy than men, having a higher ability and capability of showing cognitive empathy. And based on that alone, I can tell you that this is a field that requires a lot of cognitive empathy. So yes.
This is really a great study, because it is well known, if we can say without studies, that women would be more interacted with any situation around them, and they can deal with it. And we have seen it in World War I and World War II as well at the same time, how they really rushed there and how they managed to be surrounded by all of those soldiers at the same time, giving them the right words and taking care of them. And this is wonderful.
Exactly. If you think about it, who bathes patients? Who? Yes, we do have male nurses, of course, but who does the most tactile care, you know, touching care? So it does require that sense and that feeling, and being able to respond to whoever is in the room in an appropriate way.
Yes, and how to give good or bad news in a special way. And I know that a lot of ladies would do those things, our moms or grandmoms, in their own tactic ways.
Yes, indeed. I will say that there are men that can have these conversations and do a great job. I've seen it myself with the specialists that we have at Beit Abdallah. Men have the capability to have empathetic conversations.
Yes.
But statistically, if we're looking at the numbers, and I'm a woman of science, right? So I look at the facts. Statistically, the study involved, it involved people aged 17 to 70. So it looked at all ages, and I think it was across 8 languages. So we know that it's not cultural. If 36 countries had the statistically higher outcome than the other countries. The other countries, I think there were 21 countries where it was the same. But then they looked at age, because they saw as we age, our cognitive empathy declines, but that's part of normal cognitive decline.
Just something very great to hear about, you know. But I do really believe that within the upcoming future, even when it comes into the statistics, actually could change, because even when it comes into the way that everyone is being, let's say, raised within this world nowadays, we're even trying to address to men that it's okay to express emotion, to have these kind of, let's say, things being presented. So I think, and I believe that even when it comes into the upcoming, let's say, statistics, it could be, let's say, changing, but hopefully it's for the best, because yet again, it's more of a human let's say, thing that you're dealing with. You're dealing with emotions, you're dealing with people who's actually could be losing, for instance, a part of a family member, which is something very tragic and very difficult to adjust, even if you're really good at dealing with presenting the news and dealing with that kind of sense of emotion. But yet again, it's something out of control when it comes into families and everyone aside.
Definitely.
So one of the things that they always say, an apple a day takes, let's say, a doctor away, like you don't go to a visit to a doctor. So this is true when it comes into nutrition, that it really helps if you have a very good diet and very good deal of food. If you're a diabetic person, or let's say, for instance, a person who has obesity, that you could actually become and recover really speedy if you really take care of your nutrition.
In the sense of general health, I would say yes. But I don't agree with an apple a day phrase, because there are more nutritious foods than apples.
Indeed.
However, I do believe that if someone takes care of their own health, that their risk of developing is lower significantly. And it's not about me believing, it's what the research shows, right? But there are some illnesses or diseases that no matter what you do, you can't prevent them, especially in childhood. So congenital diseases and certain diseases, they can't be prevented. But all you can do is manage the disease to the best of your ability and manage the nutrition that comes along with it. So like, for example, a tube-fed person can be fed by tube if they can't eat via a tube that goes through the nose or through the mouth, or inserted directly in the stomach. And we know now that when we don't use institutionalized formula, so ready-made formula, and we blend foods, you can only use it with the tube that's directly in the stomach because it's wide enough, right? So we know that children do much better, have less gastrointestinal symptoms when we use blenderized, it's called blenderized tube feeding, compared to traditional tube feeding. So we do know that good and natural food from good resources that's pesticide free and organic, and doesn't come from a cow that was put on multiple antibiotics,
yes,
is much better for your health. So yes.
Yeah, so picking whatever we want to know in life, that this is the quality of life. You have to choose wisely. Just try to live the life you like, for you, for your children, and for the future. Choose wisely. This is what you say, Doctor, right?
Yes, choose wisely, because I would understand where I would say 8 years ago there wasn't as much available in the market for people to be able to choose wisely. But now there is. In Kuwait you have a range of products, you have local Kuwaiti farmers, you have, we're everywhere, and you can have everything.
Let's say that kind of awareness is actually being spread, and something very important to actually highlight and emphasize on that. So I'm very sure everyone did enjoy us. We're going to have this short break, dear viewers, and then we'll be back.
And we're back with you again, dear viewers, in the Prominent Ones. And I think we have reached the end of today's episode. A great thanks to you for being here with us, Dr. Tala, and it was a wonderful time and especially informative to talk with you.
Anytime. It was a pleasure and an honor to be here. Thank you.
We're really happy to have you here and presenting all of the great knowledge to our dear viewers. And I'm very sure, Amal, we did really, let's say, acknowledge that kind of, let's say, sense of the field that we didn't focus on before, but I'm very sure that with today, we're more aware of it.
That is so true, Hiba. We have reached a place that we haven't seen before, or yet we didn't really interact with. But with Dr. Tala, she gave us that insight into two majors that can be ready, let's say, people can go to and specialize in.
Yes, and remember that this field is actually required for women. So if you're a woman who is actually entering the field of medicine, do take care of looking through the field itself, and you never know, you could be tomorrow assisting Dr. Tala Al-Dabbous. And with that, dear viewers, that's all we have for you today. Hopefully you enjoyed watching us. See you in different episodes, and goodbye.